Good afternoon, everyone. I'm Brent Friesen, Minister of Health, Seniors and Active Living for the province of Manitoba, and I'm here with the Chief Provincial Public Health Officer for the province of Manitoba, Brent Roussin. Bonjour tout le monde. Je suis heureux d'être ici avec vous aujourd'hui avec le médecin hygiéniste en chef du Manitoba, Brent Roussin, to provide for you our regular Monday briefing. As at this time, I'll call on Dr. Roussin to make remarks.
Thank you, Minister. Good afternoon. The current 5-day test positivity rate is 1.59%, and there are 16 new cases of COVID-19 that have been identified as of 9:30 a.m. today. This brings our total number of lab-confirmed positive and probable positive cases in Manitoba to 558. Data also shows that we have 6 current hospitalizations, including 3 individuals in intensive care, 196 active cases, and 354 individuals have recovered. The number of deaths due to COVID-19 remains at 8. Our testing as of yesterday included 1,364 lab tests, bringing our total to 103,782. I can confirm that the number of cases connected to a business in Brandon is at 22. These cases are self-isolating, and contact tracing is underway to determine close contacts. The company is going beyond public health recommendations and is having a larger number of workers self-isolating than what was recommended by public health. In addition, many other protocols have been in place, including workers being cohorted. Public health officials, workplace safety and health, agriculture, and resource development, as well as the Canadian Food Inspection Agency, are closely monitoring the situation. We're in regular communication with the company, which has been quite cooperative and continues to share information with us. While many of today's cases appear to be linked to known clusters in Brandon and southern Manitoba, or are close contacts of previously identified cases, preliminary information also suggests that there are small numbers of cases with unknown acquisition, which we would determine to be community-based transmission. We've continued to say that these increased cases over these past week reminds us that we're not done with COVID-19. Where Manitobans are concerned, our reopening plans have continued. We are seeing increasing numbers of cases, but this is to be expected. We'll certainly continue to see cases of COVID-19, but we are certainly not helpless against this virus. We never have been. We know that when we focus on those fundamentals, we can alter the trajectory of this spread of this virus. And those fundamentals are staying home if you feel ill, even mildly ill, practicing good hand hygiene, keeping in mind the need for physical distancing, keeping 6 feet, 2 meters from others whenever possible. When that's not possible, wearing a mask is appropriate, and also avoiding indoor crowded places where this virus is known to spread. And we know that these precautions have helped us before, and they'll help us again. We just have to get back and focus on those fundamentals. All these fundamentals are certainly especially true to those at increased risk of severe outcomes, those over age 65, those with underlying medical conditions, those with immune compromise need to take extra caution to limit their potential exposure to this virus. Ensuring physical distancing is adhered to at all times, avoiding crowded indoor places. And when we look to places like Brandon, for instance, where we're seeing these high numbers of clusters, this is vitally important in those areas. People in those areas should take extra caution now, as we're seeing mostly identified cases, but we are seeing early indications of community-based transmission. So washing your hands, physical distancing is vital. Mask wearing, certainly when you can't physically distance, is important, but certainly extra precautions are needed in those areas where we're starting to see increased numbers. Continue to remind Manitobans to be kind to each other. Stigma has no place in our pandemic plans. Stigma adversely affects public health's ability to manage this pandemic. It decreases people's likelihood to want to be tested, decreases their likelihood to cooperate with public health, and we need that cooperation to identify places where they may have attended, to identify contacts to notify. So please, let's be kind to each other, realize we are in this together. There's no way around that. And we'll work together, stick to those fundamentals, and we'll again start diminishing the spread of this virus in our communities. Visit our website, manitoba.ca/COVID-19 for up-to-date information as usual. As far as testing, one further point we wanted to make was that individuals, it's the best timing to be tested is 24 hours after symptom onset. What we found was a number of our cases being tested many, many days after symptom onset, and so by the time we're connecting with contacts, some of those contacts are already symptomatic. So asymptomatic testing we don't recommend. Testing very early within that 24-hour period of onset of symptoms can lead to sometimes false negative results. So testing after 24 hours of symptom onset is what we are recommending. So again, thanks to Manitobans, and I can open up for questions.
Dr. Roussin, what's the size of the Brandon cluster now? Do you have a number for it?
Yeah, as of this morning, we have 64 cases within that cluster.
And can you shed a bit more light on how it developed? Because we know that there was somebody who traveled from the east and maybe didn't self-isolate that well, but it's developed quite into something that's quite big. Was there without, identifying people, was there a community event? Was there a wedding? Or can you describe how it got this big?
Yeah, well, a lot of the cases are connected in many ways, as well as geographically. There's certain areas within the community that people are living together and they're connected frequently. So there was a lot of contacts early on in the cluster leading to this.
So not just one event.
That's right.
Okay.
So you referred to clear acquisition events on Friday. What were those clear acquisition events?
These are known contacts to cases.
The frustration you just heard in my voice is I'm just repeating Larry's question here. Why will you not say that there was a wedding or a group gathering or?
Oh, well, I would if there was. There wasn't anything specific like that, but just that there's a frequent connection between the community, both geographically and community setting. But I'm not aware of any specific events like that.
Dr. Roussin, on the weekend, we had our second highest number of cases in one day. We're now at our highest number of active cases. We started shutting schools down when we saw this in April. We're now 3 to 4 weeks out from school. What are your thoughts on that? Does it make you start reassessing what is going to be needed come September?
Well, we're always reassessing things, but we've learned a lot about this virus. When we first faced the pandemic, we didn't know a lot about the virus. We had to take as much caution as we could. Now our goal is to live with this virus. We know it's still going to be here, likely a year from now, even more. And so we know there's a lot of benefits to getting kids back in school. And so we need to have a cautious plan to ensure everyone is safe with it. But we learned a lot about this virus, and these fundamentals we keep speaking about can allow us to live with this virus rather than reverting to those major restrictions and shutdowns that we had to do at the beginning.
Parents are scared, the parents that we've talked to. What do you say to parents now to ease their fears, to prepare them for back to school, the ones who are saying, I'm not comfortable sending my kids back? What do you say to them?
Yeah, and so I think that we need to be aware of this virus, right? We need to respect this virus. So certainly nothing is without risk, but there is risk to not sending kids back to school. There is risks to massive shutdowns, and so we know with kids they are less likely to have severe outcomes with the virus. The younger kids, at least, are shown to not be significant in the transmission of the virus. And plus, we have very thought out, safe plans that we continually reassess to get those kids back to school, and we're going to continue to assess the progress with that.
Mr. Friesen, what kind of conversations have you had with your counterparts across the country whose plans may be a little different? We've seen some provinces going towards masking for schools. What kind of conversations are you having with your health counterparts across the country?
As you say, those conversations are going on between jurisdictions. There are very robust plans that are being developed in Manitoba for sending students back to school. As Dr. Roussin said, there's risk in not going back to school. And I think that we're also hearing those themes from parents and families who are saying they want a return to normal. They want to return to the classroom for their children because they see the benefit in it. Of course, we all want that to be done safely. So we are some weeks away still from the start of classes. My colleague, the Minister for Education, and Dr. Roussin did update Manitobans going on 2 weeks now of our preparations, and there will be more discussions and more announcements in terms of what the thinking consists of, what the planning consists of, and all the ways that we're going to be able to do the things we need to do informed by public health in order to make sure that education settings will be in place for our students and that it will be safe to go back to school.
Has anything changed that you can tell us as of now? Are you looking at anything differently for that back-to-school plan? We are only a couple weeks out now.
Yeah, and so we're we continue to look at it. We know there's been a lot of discussion now and release of recommendations regarding mask use, so it's something that we're looking at as well, but the decisions haven't been made on that.
In terms of identifying cases on a geographic basis, is the government and public health office looking at smaller geographic areas that'll help pinpoint, for instance, North Dakota identifies by county, and so that's a smaller area, but gives people a good idea. They have maps on their website, and so you can pretty well pinpoint where cases are. Are you looking at either by RHA zone or RHA's district or municipality? Are you prepared to start identifying cases a little more precisely?
Yes and yes. So as Dr. Roussin said, you know, when we were into this for the first time in the spring, there was a lot we didn't know. And our planning and our response to this pandemic is much more sophisticated and nuanced now than it was. So we made the commitment last week that we thought that it was time to do more in terms of identifying. We don't think there's any benefit in someone knowing that someone has COVID-19 that lives 4 blocks down from you or down the street. But it's this balancing act between providing good information in a timely way to Manitobans, and then of course on the other side making sure there isn't a negative effect from over-identification. I'll make this commitment. We believe that before the week is out, we'll be able to be identifying new cases in a much more nuanced way, as you say, using zones or districts or another measurement.
Now that we're seeing community transmission, are we looking at any sort of increased regional restrictions happening?
Yeah, well, I mean, that's, you know, as we move forward, that's our approach, is to not have widespread restrictions, take a much more surgical approach to if any restrictions are required. So we haven't been looking at anything specifically right now. That's always obviously on the table. But for right now, we're you know, certainly talking about Brandon, where we see these this cluster, and we're advising people to you know, everywhere in Manitoba should be taking caution. In that area, should be taking extra caution.
With the
Right
cases
now, what
going
about-
up with the
Go
cases
ahead.
going up day after day, there's been some curiosity about enforcing gathering numbers or social distancing when you're seeing that it's not being adhered to by public health strategy. Are you looking at increasing enforcement or maybe stepping up fines or anything if people are not following your health advice as we see more COVID cases?
Yeah, and so you know, again, it's, for this, we rely on Manitobans at the individual level, at the business level, to realize where we are right now. And we're seeing increasing numbers, so everyone at that individual level can put in place today actions that will dramatically decrease their risk of infection. We always talk about hand washing, physical distancing. So really, you know, up to the individual Manitoban, you should be avoiding indoor crowded events. And that's one step you can take. As far as businesses go, by far, right from the beginning, the vast majority of businesses have done just that, protected their patrons and protected our community. There's always some outliers, and enforcement can have a role in that. So yes, when necessary, we'll be enforcing.
If we're telling people to avoid them, why are we allowing them?
Well, again, it's that balance of are we going to continually wax and wane our restrictions, or it's much better for Manitobans to make informed choices, to be able to protect themselves and protect others. So we really want to get that message out that people are making informed choices, that businesses are putting things in place to protect their patrons, and by far and large, they are.
Why not more restrictions in Brandon? How?
Right now? Yeah, I think that this is still largely related to a cluster. Most of the cases that are identified are still contacts of known cases, so they've been self-isolating, so there is some community-based transmission, but it's early on. And we think that by messaging, by the things that Manitobans have learned, this is our opportunity to live with the virus, not shut things down.
And more on Brandon, I mean, active cases now result in usually some hospitalizations later. What's the plan for managing hospital resources in Brandon? Will those patients go to Winnipeg? What is the capacity in Brandon? Can you elaborate on that?
Each region right from the beginning has worked on their capacity plans and how they could increase capacity, and then we have that worked out at the provincial level where if capacity was exceeded in one area, we could divert it to other regions. So.
It sounds like a few minutes ago, you weren't ruling out for Brandon if this cluster got fairly big that you could have a different set of rules in terms of gatherings and that sort of thing for Brandon. Is that something that if a cluster gets to a certain number, or if there's more evidence of community spread, that you could have different rules for Brandon openings? And
That's a thing that we're really looking at, is if whether we could find a way to have a much more targeted approach so that we don't look to restrict all places in Manitoba, even places that aren't seeing really any community transmission. So moving forward, yes, if we see that there would be a benefit to a targeted approach like that, then we're going to take that.
is there a set number that would trigger this, or what would trigger it?
Yeah, and so there's multiple things that we always look at, so I can't say that we have one thing or one set of numbers that we would look at. We'd look at that community transmission, we'd look at the effect on the healthcare system, and a number of those type of things.
Could you touch on the testing numbers a bit? I know yesterday we were at just over 100,000. With the new ones today, it doesn't quite get us up to that new 103,000. There seems to be a bit of a difference in the additional tests and the complete number of tests. So I'm wondering if that's just a discrepancy on them, or if we're waiting for other ones that maybe just were counted in the total that will be reconciled.
Yeah, I don't know specifically. It might be just, we often get preliminary numbers early on, and so it might have been just not updated.
How is our testing right now?
The numbers of tests being completed is fairly high, as we average quite a few tests over the 7-day period. We're averaging over 1,300 per day in the last 7 days. So I think this is going to put us into a real good spot. Our capacity could deal with more, and you can see that there's local hotspots and that we have to work on. But I think our testing capacity is where it needs to be right now.
We're creeping up to almost 10% of the population that we've tested. How do you feel about that, or both of you feel about that, and what does that tell you based on the numbers we have, if anything?
Well, I think that's a significant amount of the population that's been tested. It shows the devotion of the lab community here in Manitoba being able to step up to be able to already test almost 10% of our population. Moving forward, we'll need that capacity, especially in respiratory virus season. And if we see heavily transmission of respiratory viruses, if we're testing about 1% of our population a week, then that's quite a high number.
Dr. Roussin, you've repeatedly stated that if people can't avoid distancing indoors, you recommend a mask in that instance. yet there is no mandated masks nor recommended for schools. How do you reconcile those two statements?
For certain schools, like in other jurisdictions, there's mandated masks?
Here in Manitoba, you have repeatedly stated in general that if, as recently as yesterday, that if you cannot avoid distancing in an indoor situation, you recommend a mask.
Right.
On the other hand, there is no recommendation, let alone mandate, for mask wearing when schools resume. So what are people to make of that disjunction?
Yeah, well, we're still working on our final recommendation. There's been the national recommendation that's come out. We've seen other jurisdictions move to mask recommendations in schools, so we're still working on that.
And on that note of schools, the federal guidelines have gone from musing to now stating smaller class sizes are recommended. Manitoba is not planning that. And ventilation, keeping windows open, is recommended. That was something you were looking at. Can you comment on both of those?
Yeah, and so the class size issue is obviously all these things have huge implications to be able to implement. We're looking at the need for physical distancing, at least that 1 meter separation. We're looking at what we're going to be doing with masks as well. Again, ventilation is an important add-on to things. We know that this is not this is not transmitted through the airborne route predominantly, but just like anything else, that's why outdoors there's much less transmission events, just because we have essentially infinite ventilation there. So these are all things that we'll be discussing further with the ministry.
Thank you, Doctor. We're going to go to our reporters on the phone now, starting with Michelle from the Brandon Sun.
Hi there. My first question is about a second testing site in Brandon. The lineup for the drive-through testing site goes on for blocks and blocks and blocks and blocks, and clearly you've got something going on around here. So are you considering a second site?
So I'll respond to that. Thank you, Michelle. I heard that there was this morning a lineup for testing in Brandon at the one site that was some blocks long, and I would say that's too long. And so I understand that Prairie Mountain Health leadership is really leaning into this challenge and was doing so before today. As a matter of fact, I can report today that I believe that they are extending the hours of operation. They are bringing more people on to assist with the work, including those who are taking the swabs. We understand that there is plans in place to go to 7 days a week for the screening sites, that the hours of function will be extended today, but that as early as I believe tomorrow, there could be a second site in place at the Keystone Center, and I can get you an update on that. So remember that only 3.5 weeks ago, we were receiving questions to say, why do you still have this much capacity? I say that in order to indicate we have to have that ability to flex up when we need it, and right now Brandon needs it, and I'm pleased to see that steps are being taken to flex up. Okay,
thank you. I guess the second question is in terms of community transmission. When that starts in a community, what have you seen in other areas in terms of the numbers ramping up once that begins?
Yeah, and the community-based transmission, as the numbers of unknown acquisitions increase, then we expect the numbers to increase over time. The whole concept of identifying cases early, having them self-isolate, and in that contact investigation, having those contacts self-isolate means that a certain proportion of those contacts will develop COVID-19. In Manitoba right now, that secondary attack rate is about 14%. But what will happen is that those 14% are going to be self-isolating when they develop symptoms. So they're not going to have any or very few contacts, so the transmission chain diminishes. When we have unknown acquisition, then we could have a significantly increased amount of contacts that we have to investigate.
From CJOB, Diana.
Good afternoon. It's Diana from CJOB. Dr. Roussin, what is your response to people who say, look, we've got more active cases now than we've ever seen before in Manitoba. Why are we not kind of rolling back some of these loosening of restrictions? Obviously, given that the restrictions that were put in place months ago were when we had fewer active cases than this. What do you say to those people?
Yeah, and I think it's that same message, is that nothing's off the table. If we need to protect the health of Manitobans, then we'll do what's required. But what we need to look for is that this virus we're going to be dealing with for the next year or more. So we need to find ways to live with this virus and not continually shut things down when we see cases. We have to get used to seeing cases. We have to get used to living with the fundamentals, which will allow us to not restrict things again to the nature we had in April, but also reduce the transmission of this virus. So it's not a month-long thing that we're dealing with. We need to find ways to live with this virus.
And just as a follow-up, with regards to the patients in hospital and ICU, how many are on ventilators? Are you able to kind of share details on what those hospital stays have been like? Like what's the current longest length of stay for someone who's in hospital right now?
Yeah, so we have one patient that's on a ventilator right now. We just have overall statistics where the average length of stay is about 12 days.
From the Winnipeg Sun, Scott.
Hi, question for Dr. Roussin. You've made reference recently, the last few days, or the last few times we spoke about indoor spaces and that. Are you seeing more of just people kind of clustering indoors, or does that just have to do with, I guess, household contacts and stuff like that in that cluster in Brandon?
So yeah, so I mean, I think that we've seen or heard of these acquisition events. So like I say, we do a contact investigation on individuals and look who may have been exposed. When we have community-based transmission, where by definition we don't know where somebody acquired it, then we do an acquisition review to see where that was, and we see often those are at weddings, funerals, family gatherings, and so we are seeing these take place, large numbers. And we know that transmission does take place in these events. So it's just that message that we really have to get back and be cautious about those large gatherings and get back to those fundamentals.
Thanks. And follow-up with the active cases right now. I guess not the active cases, the 5-day testing rate, PS positive rate. You said between 2 and 3% would be community-based transmission, I believe, something like that. You can correct me if I'm wrong there. How close are we getting to that? I mean, it keeps going up. I imagine you're going to see more cases in the Brandon cluster and that sort of thing. Are we close to having a community-based transmission, I guess, quote-unquote, outbreak?
Yeah, so a couple of things there. So as that positive test rate approaches 3%, then that's more likely to include community-based transmission, but not necessarily, and that's why we don't follow just one indicator. So we have this rate, this 1.59% right now, but we know a significant proportion of that are clusters, are known clusters, known contacts of cases. So it's that's skewed higher than it actually represents right now. So that's why we follow a number of indicators, because not one can give us the full picture.
From CBC Radio Canada, Gavin.
Yeah, just to follow up on that question, Dr. Roussin, you had said specifically that it's that number remained under 1.5%. That was considered very low transmission rate and low number, I guess. What's the significance of it going specifically over that 1.5?
Yes, I think by itself there isn't that specifically indicates anything. We know the trend of it is going up, so we're certainly watching that. But we know a lot of these cases are linked to clusters, linked to other cases. So that's more of a reassuring component of that. So we look at that. We're going to look at the number of non-EpiLink cases, those community-based transmissions. We look at the stress on our healthcare system as well. So we look at a number of variables. So that one certainly is trending in the higher direction, and we're going to continue to watch it. But it's not the only thing that we keep our eye on.
A question about schools concerning substitute teachers. Sorry, are you looking at a system where these could be assigned to one single teaching establishment, kind of like the system for long-term care workers? What sort of things is the province looking at right now for substitute teachers in the province?
So I think that, Dr. Roussin may offer additional information, but I would say this is part of the discussion that we're having. Broadly speaking, it's like you say, it's related to the discussion we had on personal care homes and how we were trying to limit the number of people that were going to those places. So yes, broadly speaking, we're giving thought to how to limit the number of people who come through those front doors of the school to serve or to be in the school.
From CTV Winnipeg, John.
We understand a restaurant in Winnipeg was recently given a health hazard order, and now patrons there are being asked to remain seated at all times, and all food and drink will be served by staff. We're wondering, will all bars and restaurants be asked to have the same sort of procedures? And if not, why just this one restaurant?
So we're looking at protecting the health of Manitobans, and our orders are set out to do that, but also more than that is our messaging, that it's up to every individual, up to every business to do their part to protect the health of Manitobans. So there have been businesses that have been warned, have been educated, have been fined, and if they continue to put the health of Manitobans at risk, then we'll do whatever steps that are necessary. So we've, by and far, the restaurant industry has stepped up and have appropriate protocols in place. And so ones that don't, that are putting the health of Manitobans at risk, then we need to enforce these things. So that's just the message right now, is that we are in a pandemic. We're seeing our cases increase. It shouldn't be necessary to have to enforce these things to protect the health of Manitobans, but we will.
Thank you. We've heard that there may be a number of cases in Carberry. Can you confirm that and let us know if this is in any way linked to the McCain plant?
No, I don't have any specific details on that I can confirm for you.
From CTV National, Jill.
Good afternoon, Dr. Roussin. Can you tell us if any of the cases in the large Brandon business is there transmission in the business? Is there spread in the business?
Yeah, so as of right now, we're not seeing evidence of transmission within the facility. We have those 22 cases. We don't, many of them we link to that large cluster, not all of them, but we haven't seen evidence of interfacility transmission at this point, but we're watching that very closely.
On the 64 cases in Brandon, I believe you said before that it was believed to be linked to a case of travel from the east. Is that still believed to be the case?
There was one such case that was early on in that cluster was linked to a traveler from out east. It's not clear on the sort of the timeline whether that was in fact the beginning of it, but there is that connection between a traveler from out east.
Thank you, Doctor. We have a few moments left in this afternoon's session. We'll go back to room 68 on the floor.
Dr. Roussin, can you clarify that 64 Brandon cluster case? Is that just 64 in the Brandon cluster, or 64 cases in Brandon in total?
That's in the cluster itself in Brandon. I don't have the numbers. There's a few that aren't linked in Brandon.
And what's the positivity rate for Brandon or Prairie Mountain?
Yeah, it's a tough one to get because we have to get the denominator from that and do. So I don't have that right here.
You made no mention this morning of a case involving a Walmart employee on McPhillips, and that was because there's no danger of spread from that
That's
case?
right, yeah, as per our typical response. So in that instance there, this person was at work just about 48 hours prior to the symptom of onset, so very, very low risk. All of the contacts were identified. There was no risk to the public, so we didn't decide to announce that.
Dr. Roussin, your messaging has changed quite a bit, and obviously things change as we get more information, but it went from early on to stay home to now we're living with this virus. Can you maybe speak to people a bit about why that's changed so much, and is your message, yes, we're living with this virus, but still stay home?
Well, it's our ability to learn and live with this virus. So at the beginning, we didn't know a lot about the virus, so the safest message was to stay home. Now we've become accustomed to those fundamentals that we can go out. We can go to restaurants, but we need to maintain that physical distancing, So I've gone to restaurants with my family. If I walked into a restaurant that was crowded, I would walk out. So we need to kind of live with this virus. So those people who are at increased risk of severe outcomes, they should be considering staying home more frequently, doing less that puts them at risk. But for the most part, we need to find ways to continue our lives, but cautiously.
Minister Friesen, how do you feel about Manitoba being the only province in Canada with spiking cases at this moment?
Well, I mean, I think at different points in time, then that could have been directed to other provinces. Right now, in the last 2 weeks, we have seen an increase of cases. Before that, we saw 13 consecutive days with no cases at all. I think maybe it goes exactly to Dr. Roussin's theme, which is that we have to learn how to move around in our communities and in our neighborhoods and in our workplaces in a way that we have confidence, but we know how to do the right things. And so I continue to say that, our story is being written in the aggregate, but that our collective efforts rely on our individual efforts. So far, Manitobans have been doing the right things. Today, I would say, as Dr. Roussin said last week, today, if you're in Brandon, you should be washing your hands often and maintaining social distance. And, if you're in Lac de Bonnet, you should be doing the same thing.
Dr. Roussin, what's your best estimate of the 196 active cases? How many are community spread?
Of those, I don't have the specific number. What we know overall is we're about at 11% overall of our cases. We're community-based transmission. Yes.
How does this change your plans going into flu season as we start seeing numbers rising now in Manitoba? What are you changing, preparing, going into that season, which quite frankly isn't too far away?
Mm-hmm. Yeah, so it doesn't really change our plans. We thought that we may have had more of a reprieve before that started, but that's not going to be the case. So we need to continue our plans for flu season while we're continuing to battle COVID here. So we know that flu season comes. Unlike COVID at this time, we do have a vaccine. So we're expecting increased uptake for that vaccine. We need Manitobans to do what they can to protect themselves and others, and the best way to do that is with that vaccine. We know that there's going to be a number of people with respiratory illness come fall. There is every fall. So we're going to need increased ability to test them, but also to assess them because people with respiratory illness also need to be assessed for treatment as well. So we're working on all these plans, and this doesn't necessarily change it, but it just adds that complexity to it.
We see regular flu clinics. I know there were some communities in BC that said they weren't going to hold the regular style of flu clinic just because of the possibility of having more and more people in close quarters.
Yeah, well, it's going to certainly look different, and so we need to. We're working with the regions to come up with how best they feel to address their population. And so you're right. Clinics may occur, but they're going to look different. We're going to have to address the issue of crowding.
Minister Friesen, just one clarification on something that I seem to have misheard or misunderstood. We are getting a new, more detailed breakdown at the end of this week, or you will announce when we'll be getting more detailed breakdown?
Oh, we hope before the end of the week it'll be out and available, that we'll be able to announce those cases by some kind of an additional level of specificity, zones or districts or something. We've said before, a case in the Southwest should not necessitate the closure of the Northeast. And so we're trying to get more to that level of detail that we believe Manitobans are ready for and will accept, and stop short of identifying to the point where someone could feel overly identified and there could be a negative effect.
Any more? The Liberals put out a press release about government buying hand sanitizer that has since been recalled? Is that because of, has it been thrown out? Where was it used? Did you see the release? Have you heard about it?
So I heard about a recall on hand sanitizer, and I would say, someone asked the question last week, what did Manitoba do well when this global pandemic hit? And one thing we did well in this province is we really marshaled resources to get the materials that we would need for COVID-19. And certainly there was no one criticizing the effort to bring into jurisdiction masks and gowns and sanitizing sprays that we would need in our system. We have a better stockpile now than we did 3 months ago, and that is thanks to the efforts of a bunch of heroes who went to work to get that here. If there's something that needs to go offline, I can tell you we have very careful inventory controls, and that they'll be pulling off of shelves anything that is deemed to be unfit to use.
Last one? No?
One thing, you had mentioned an ADM in your department back in April identified 5 things that could bring back restrictions. And you had said a couple of times last week that you would, at one point, give us a clearer indication of what those triggers would be. What's the timeline for giving us those triggers prior to the fall?
Well, I would frame it this way: there's a number of indicators that we look at. I wouldn't necessarily deem it as triggers because there's not going to be just one thing. But yeah, those indicators. Again, shortly in upcoming weeks, we're looking at releasing that as part of our. A detailed plan to Manitobans on what things look like. Should we need to restrict certain areas or businesses, what to expect. So we're working on that, and I don't have a specific date for you, but we're hoping that in the upcoming weeks or so.
This would be more for if cases go up again in the fall and we need to be bringing this back. I mean, we're 6 months into the pandemic now.
Yeah, right. So this is that plan now where we're going to try to do whatever we can to avoid the widespread restrictions. So we said that, with schools, we have to expect to see cases of COVID in schools. That's not going to require us to shut down or all schools. We're going to deal with it on a case-by-case basis. Same thing, we might see transmission events in, certain regions. We don't want to have restrictions in all regions. So this is all part of that process.
Thanks, everyone.
Thank you very much for answering these.